And as a new nurse, there's nothing scarier than walking into a room and a patient or their family member asking you a question and you don't know the answer. This can sometimes paralyze us from wanting to actually be more independent and going into rooms without our preceptor. But you don't have to know everything, you just have to know where to find it. So I'm going to go over 5 things you need to know where to find these things on your unit, and it's going to help you to be more independent and also to help you to answer questions when you don't know the answer or you just need to be able to find resources. Number one are your policies and procedures. This could be your hospital policies and procedures, but also your unit, because sometimes different units have more specific policies on specific things. So make sure that you know where to find the policies and procedures that you're supposed to be using on a daily basis for your hospital and for your unit, and how to access them pretty quickly. So maybe saving them under your favorites on the website or saving a link somewhere where you can easily access them. Number two is going to be your skills. These are whatever skills you use on your unit. Sometimes you may put Foley's in every single day for a week straight, and sometimes you may not be able to do a skill for a long period of time. So maybe you just need a refresher on what the order of operations are on whatever that skill is or what supplies you need. So be able to have some type of reference where you can log on and watch a video on that skill or get a checklist that tells you what you need to do step by step. And most hospitals have access to this through like Elsevier or whatever resource that your hospital uses. Just make sure that you know how to get to it so you can quickly reference that if there's a new skill that you have to do or a skill that you need to refresh your memory on. Number three is going to be medications. You need to be able to know what medications are used for, the contraindications and all of that. But most importantly, whenever you are hanging IV medications, you need to understand which medications are compatible with what. So make sure that you have a quick reference that you can get to that's going to be able to go over the medication for you. Once again, most hospitals have this resource. It's just a matter of finding a way to save it so that it is an actual quick reference. A lot of times you have to go through a bunch of different tabs, but know and write down how to find that and maybe even save it to your favorite so that you can easily access it. That way you can answer any questions a patient might have about the medication or go over it before you go into that room to pass meds, and also know before you hang any drips what's compatible and what is not. Number four is people. Every unit tends to have at least one person that just absolutely loves talking and teaching, and they are a phenomenal resource. But for you as a new nurse, you need to know who your go-to people are, people who don't mind answering questions, the people that will take the time to actually show you how to do things, or they'll explain to you, or if you ask where something is, they're not going to just give you roundabout directions. They're going to show you where things are. People that make you comfortable asking questions. You need to have those go-to people. Of course, those people are not always going to be available, so you need to feel comfortable asking anybody on your unit questions. But if you have more deep, intricate questions that need more long answers, or you need to have someone that's a resource that you can go to feel completely comfortable asking them any type of question, make sure that you take note of who those people are. Because those are the people, like I said, every unit tends to have at least one person that actually loves teaching. And those are your people that you want to make sure that you go to, that are going to show you how to do things the right way, not just the quick way to get you out of their face because they're annoyed or they don't have the time for you. And last but not least, this is one of the most important ones. It is your new nurse on the block binder and your reference tool. Now, this is a binder that you are making for yourself. You're going to start this binder and start it from scratch when you first start nursing, and you're going to put all of your resources inside of it. As you discover different resources, as you have to print different things, as you have different templates that you're using, or different templates and resources that you're getting from our website, you're going to go and put those inside of your binder, and you're going to keep them organized. This binder is your reference, so whatever you want to put in there that has to do with your hospital and your specialty specifically, put it in there. Anything that you need to to reference throughout your shift or throughout your orientation, make sure you put it in there and take notes on that, like highlight and put notes on the side of it. This resource binder is going to help you throughout the entire first year of your nursing career. Like I said earlier, there are some skills, some medications, some things that we do, and we don't do them every single day. So when it's time to go back to reference that thing that you haven't done for 2-3 months, it is going to help you feel so much more confident that you already have that resource inside of your binder you can quickly reference. And it's already going to have the notes on the side of it that help you to like jog your memory of what you need to do. You can also include important phone numbers and emails and how to contact important people in this binder. This binder is your reference for anything that you're going to need help with along the way. And having this binder on you is going to serve as a phenomenal resource to just help you feel more confident in your day-to-day operations working as a registered nurse. And especially once you get off of orientation where your preceptor is not going to be at arm's length anymore, you're going to need to have all those resources that your preceptor gave you, your nurse educator gave you, and that you've accumulated over time to be able to navigate your shifts. I guarantee you this is the number one tool that's really going to help you to feel so much more confident as a new nurse and to really be able to help yourself as you are marching through your long shifts. So once again, you don't have to know everything, you just have to know where to find it. And those 5 tools, having at least 1 to 2 examples of each of them and your reference binder is going to help you to be able to navigate more confidently. And even if you don't know the answer, it's okay to not know. You now have the resources to be able to go find the answers. So, hope this video helped.